Hello. First off, let me introduce myself. My name is Jacqueline Hurst, and I'm in school in the nursing program. First of all, let me tell you a little bit about myself. I wanted to be a nurse for a pretty long time, and I actually worked as a LPN for 7 years and as a CNA for 3 years. And it's something that anybody should know that wants to go in nursing. Nursing isn't a career to go into if you're just in it for the money. You got to have a real love of people, have a compassion, the patience to work with people under any and all circumstances. So if you're in it just for the money, it's a job that you'll be miserable at and you'll hate going to day in and day out. Myself, I enjoyed the 10 years that I actually worked in the nursing field because I've always loved working with people and helping people. So nursing to me is the perfect job. Okay. Um, my career that I want is to be a registered nurse. Registered nurses provide care and coordinate the care of the patients that they take care of. They educate patients and they educate patients and the public about certain diseases and various health conditions and provide advice and emotional support to patients and families. Nurses work in a various number of places. They work in hospitals, doctor's offices. They do home health. They work in nursing or rehab facilities, correctional facilities, schools, um, even in the military. To become a nurse, you have to have a diploma from an accredited nursing school or an associate's degree or a bachelor's degree. A lot of hospitals require that you have a bachelor's degree to be hired there, or at least a few years of nursing experience. Also, besides having a degree, you've got to be licensed by the state that you plan to work in. Employment for registered nurses is projected to grow 16% between the years of 2014 and 2024. This is due to a number of reasons. The increased emphasis of preventative care, increased number of chronic diseases, people are living longer and therefore needing more healthcare services. Typical duties for the registered nurse. They record medical history and symptoms, administer medications and treatments, make care plans, or contribute to plans that are already existing. They observe patients and document their findings. They consult with doctors and other members of the healthcare team. They have to operate and monitor medical equipment, help perform diagnostic tests, and analyze the results. Teach patients and families how to manage the treatments, how to manage illnesses and injury, and explain home care for after treatment. These are just the basic duties of an RN. The duties get a lot more specific if you have a specialty or a number of specialties, such as a critical care nurse. The critical care nurse deals with the intensive care units in the hospitals, or a pediatric critical care nurse, which is a critical care nurse who deals with children and teenagers who are in intensive care with serious illnesses or injuries. Registered nurses may be needed to work at any time. If they work in a hospital or a nursing facility, they may be required to work nights, weekends, holidays. They even have to be on call sometimes, meaning that you can get a call at 3 in the morning and you're expected to get up and come in to work then because they're short and they need that extra body right now. Important qualities in an RN are critical thinking. You got to be able to assess a patient, actually assess your whole patient load. Know which patient needs to be taken care of first. Prioritize your time with each patient. Communication skills. You have to be able to communicate with the patient, get to know the patient's needs, the symptoms of the patient, and to be able to communicate these needs to the doctor. This is especially important if you work in a nursing facility where the nurses are the backbone of the facility and you talk to the doctor by phone. The doctors don't generally come in the nursing facilities every day. So you have to be able to communicate these needs of the patient with the doctors over the telephone. Compassion. You definitely have to have a love of people and have compassion. You can't just go to work every day and have no feelings for the people that you take care of. Because the people there, they need more than just medical care. They need to know that somebody actually cares about their feelings. You have to be detail oriented. You got to make sure that you've given the right medicine, the right treatments to the right patient. They've got to have it at the right time. You sometimes have to deal with 20 patients when you work in a nursing facility. So you got to pay attention to the details and make sure that you're working with the right patient and make sure that they get their medications or the treatments at the right time, that your diabetic patients get the medications before they eat, and you just have to pay attention to the small details. Emotional stability. You have to be able to deal with death and dying. It's something that in the medical field you see every day. So you have to be emotionally stable enough to deal with that. You have to be stable in time of an emergency and not lose your cool when you just your whole brain has to be into what you're doing. Organizational skills. Keep everything organized and prioritized. Those are two really important things. You have to be organized to make sure you got it. If everything is in order, things will just fall into place better. And last of all, physical stamina. You're on your feet a lot. There's patients to be lifted, patients to be turned. Just running back and forth from patient to patient. You've got to be physically fit and have strength so that you can do this job on a daily basis. Pay for a registered nurse. The median pay is $67,940 annually. A government nurse makes $72,100. State, local, and private hospitals is $69,510. Home health nurses make $63,840. And the physician's office is $60,820. And nursing and residential care facilities, $60,370 a year. The lowest 10% earn less than $46,360, and the highest 10% made more than $101,630. Just a few fun facts about nursing. January 27th is National School Nurse Day. May 8th is National Student Nurse Day. Lucretia Lester was a well-known nurse and midwife who attended to 1,300 deliveries, and of all of those, only 2 were unsuccessful. Mary Todd Lincoln, Abraham Lincoln's wife, was the only U.S. First Lady who helped in Union hospitals during the Civil War. She was a volunteer nurse at the time. And last but not least, James Derham, a black slave owned by several doctors working as a nurse. He bought his freedom by using his nursing salary, and later became the first African American physician. Well, I hope my little presentation gives somebody or everybody some information on being an RN that they didn't know. Being an RN is a fulfilling job. If you want a job where you get a sense of doing something to help somebody else, this is a job for you. But like I said before, if you're in it for the money, it'll be a job that you hate every day, because you got to have the patience and the love of people. I hope you enjoyed my presentation. Thank you.